One thing the patients are always concerned about is how am I going to look after this procedure is completed, and how big a surgery am I going to have, and how many sutures am I going to have. Many times the surgeon can estimate to some degree what that's going to be like. We don't know completely until we have the tumor out and we then can plan the reconstruction. Um, in as part of what we do after we remove this, we have a wound assessment after the skin cancer has been removed to decide what is the best method to repair the area. And depending on the patient and depending on the location, there are various ways that that can be done. It may be as simply as pulling the two sides of the skin together. It may be more complicated where the skin is pulled together with different techniques called a flap. All of these things are done with an eye to make the scar as small as possible, to hide the scar along cosmetic anatomic boundaries. What I mean by that is the scar is much less noticeable if it's between your nose and your cheek is where you put the scar, or if you put it along the natural folds in the skin, or if you put it along natural cosmetic boundaries, say an eyebrow or under the eye or something like this. When we do these things, we can often camouflage the scar. I have many situations, I can't promise this for every patient, but I have many situations where we come back and the patient and myself are having a hard time finding the scar. And if we could get that, that's awesome. Usually it's not a problem to get that even. When the patient is seen at 6 weeks or 3 months for a follow-up evaluating the wound or the scar, we also look at the quality of that scar and the cosmetic quality of that scar with the patient. Many times nothing needs to be done. There are things that can be done in certain situations if that scar is more noticeable than the doctor or the patient would like. Certain treatments can be done to smooth the scar or to make it less noticeable. That can be done with some other surgical treatments where the scar is lightly sanded, or it can be done with certain laser systems that either remodel the scar or take away some of the redness in the scar.